Hi, good morning, everyone who's joining us here. We will be starting shortly, so hang tight.
Isabel,
Yes,
can you go ahead and kick it off? And then, Aurora, will you let Dr. Ramirez into the panelist room?
I'm not able to. I'm not host anymore.
We're good. Dr. Ramirez is now in as a panelist, and we're ready to get started, everyone.
I'm not able to. I'm not host anymore.
We're good. Dr. Ramirez is now in as a panelist, and we're ready to get started, everyone.
I hear an echo.
I think it's gone now.
Okay. All right. So good morning and welcome everyone to the Coalition of Orange County Community Health Centers Coffee Connections event. We are thrilled to have you today here virtually on Zoom and through Facebook Live. My name is Isabel Becerra, and I'm the CEO of the Coalition of Orange
Isabel
County
Becerra.
Community Health Centers, and I will be your host and moderator for the event. Before I continue, I'd like to invite anyone who needs Spanish language interpretation services to click on the interpretation button at the bottom of your Zoom screen to join Coffee Connections with simultaneous Spanish language interpretation. Para los participantes que están con nosotros y necesitan servicio de traducción de inglés a español, ofrecemos interpretación simultánea en este evento. Simplemente selecciona el botón de interpretación al fondo de su pantalla de Zoom y seleccione español para escuchar este evento con interpretación en español. Muchísimas gracias. For those of you who are new to our Coffee Connections event, welcome. These gatherings are crafted to foster unity, connection, and education among a diverse array of participants, including health center staff, community-based academic, governmental partners, coalition staff, policymakers, and other stakeholders. Our aim is to spark meaningful dialogue and drive collective action on a critical healthcare and public health topics that directly affect the communities of Orange County. Through these events, the coalition strives to create a platform in which we have a shared understanding and common language, as well as a space for continued collaboration to further drive action towards a healthier Orange County. And for those of you who have joined us before, welcome back. Your continued participation and engagement in our Coffee Connection events are invaluable. Together, we're building a stronger network, deepening our understanding of key issues and forging pathways for positive change within the Orange County communities. Thank you for your ongoing support and dedication. Today, June 7th, marks Gun Violence Awareness Day. Before we dive into our topic, Community Health in Focus, a delivery systems approach to gun violence, I want to acknowledge and mourn the tragic and preventable losses experienced in this country every single day. As we continue to hope for a healthier and brighter future for our communities, I'm pleased to dive into today's Coffee Connections event, focused on the serious public health issue of firearm violence and injury. Over 100 people will die and over 300 more are injured each day in the United States from a gunshot wound, according to the Kaiser Family Foundation and CDC. This leads to ripple effects on survivors and families, including mental health issues, substance abuse disorder, and more. In recent years, firearm injury has surpassed car crashes to become the leading cause of death in U.S. children. The leading cause of death is suicide. Over average, 60% of gun deaths were suicides over the last decade. Firearm suicide death rates have been rising since 2006, and firearm homicide rates have been increasing since 2014. Firearm deaths are distributed across rural, suburban, and urban areas, but generally highest in communities with social and economic vulnerability, communities affected by racial inequities, and communities that are being served by our organizations. This issue profoundly affects individuals, families, and communities, making our conversation today both timely and critical. Looking at firearm violence and injury as a health problem means we can research and implement public health solutions that work. The purpose of today's event is to explore the multifaceted impact of firearm violence on community health and to discuss innovative delivery system approaches that can mitigate its effect. We have convened a distinguished group of experts, practitioners, I'm sorry, my screen. Can everybody still hear me?
Yes, we can.
Thank you. I'm so sorry. My screen is back up. We have convened a distinguished group of experts, practitioners, and researchers to foster a shared language and understanding around this issue. Their insights, strategies, and best practices will guide us in our conversation. Addressing firearm violence and injury requires a collaborative effort across various sectors, including healthcare, law enforcement, education, and social services. Our discussion today will highlight how delivery systems play a crucial role in violence prevention, providing support to those affected, and promoting overall community well-being. Let's engage in a productive conversation that will inspire action and foster partnerships to make our communities safe and healthier. Now, before we jump into today's vital discussion, let's cover some housekeeping guidelines. Please keep things professional and respectful. Let's steer clear of anything offensive, discriminatory, or disruptive. Feel free to dive into the conversation, ask questions, and share your insights. We thrive on diverse perspectives and constructive dialogue. If you have a question, please use the designated Q&A feature. This helps us keep things organized and ensures everyone's questions get addressed efficiently. We're committed to fostering a safe environment for all. Any comments or questions that are deemed inappropriate, offensive, or unrelated to the topic at hand will be dealt with immediately. We'll remove any inappropriate or off-topic content, and if necessary, take further action, including removing the participant from the event if necessary. We value your input. After the event, we will provide a short evaluation form so you can share your thoughts and suggestions for future Coffee Connection events. Now, to begin the event, we have Vice Chairman Doug Chafee, who is the 4th District Supervisor for Orange County. The 4th District includes the cities of Brea, Buena Park, Fullerton, La Habra, Placentia, Stanton, and portions of Anaheim and unincorporated communities. Most recently, Vice Chairman Doug Chafee and Supervisor Sarmiento have been hosting anonymous gun buyback events, which he will talk about in his welcoming remarks. Vice Chairman Chafee, the floor is all yours.
Thank you for that. I'm able to join you, unfortunately by Zoom. My connection is not working. And instead, I think you're seeing my wife's face, who is my ambassador. So you have a much prettier face involved in your conversation. So if I may make my remarks, and if you can't hear me. So let me start off. For decades, America has been plagued with a gun violence epidemic. On average, in America, 32 people are murdered by firearms every single day. Additionally, 51 people take their own lives with a firearm daily. These numbers are not just statistics. They are lives lost, families shattered, communities scarred by gun violence, even here in Orange County, including some of the tragedies that have affected our community. For example, recently the Cook's Corner mass shooting in August of 2023, where gunmen killed 3 people and injured 6 others at Trabuco Canyon Bar. Then in July 11, 2022, we had a 7-11 crime spree occurring in 2 of my 4th district cities and the city of Santa Ana, in which 3 people were fatally shot. In May 2022, we had a hate crime shooting in Laguna Woods, Taiwanese Presbyterian Church, injuring 5 people and killing a local doctor who charged in to try to save members of his congregation. And Orange County's deadliest mass shooting at Seal Beach Hair Salon in October 2011, leaving 9 dead. And these are just to name a few. There are many other incidents of gun violence that have occurred in our county. According to the Orange County coroner, in 2023 alone, 161 people died by gun violence. Each of these numbers represents a story of profound loss and devastation. It's possible that there were fewer guns in circulation. Some of these tragic losses could have been avoided. Now, what steps can our local government take in response? Must adopt an innovative approach to tackle this complex issue head on. One way we can address the misuse of firearms is by providing avenues for the safe disposal of unwanted guns, alleviating the burden they pose to their owners. Those who inherit firearms, for example, often seniors or widows, they don't know what to do with them, but they pose a threat to the owner's safety. There are many who lack proficiency in gun safety and risk accidentally hurting themselves or others. Additionally, there are many who do not properly and safely store their firearms and risk them being stolen, ended up in the wrong hands, or picked up by a child and misused. The Bureau of Alcohol, Tobacco, Firearms, and Explosives reported there are over 1 million stolen firearms in the United States. In 2022, over half the gun thefts were from cars, according to crime data from the FBI. Safe storage of weapons is vital for our community's health. For those who are willing and happy to safely dispose of their firearms, they reduce the risk of accidents, the risk of them ending up in the wrong hands. That is why I decided to initiate the county's first anonymous gun buyback in October 2022. I was the first supervisor in Orange County to do that. It was a 4th district gun buyback because the funding for it came from my discretionary funds. But we didn't limit who came in and disposed of a gun. It was open to anyone. They wanted to come by and work through the process and trade their weapon in for credit cards. So we enlisted the support of local law enforcement, with 7 local police departments providing the staffing. In that instance, the Placentia Police Department took the lead, and that event occurred in their city. So it became abundantly clear we must continue our efforts. We held another gun buyback in partnership with Supervisor Sarmiento last month. The same 7 local police departments providing staffing. This time, led by the Anaheim Police Department. And curiously, the Orange County Bomb Squad endorsed the effort. On a combined basis, our two gun buybacks collected a total of 757 firearms, including 53 assault weapons. Part of what we did, because we realized people turning in firearms may have other arms, some collect a large number, so we offered them a free gun lock that locks the trigger until they're able to unlock it and keeps others from using the firearm. It must be unlocked by the right person who has the key to do it. So we dispose of these weapons after they've been processed. It's an anonymous buyback. We don't ask questions. We have them come through the line, keeping their weapon in the trunk of their car. We do not allow them to leave the car. We don't want any weapons in their hands. They come to a station and the trunk is popped and an officer comes out and collects the weapon. And then they determine how many credit cards we're able to give them based on the value of the weapon. We paid more for assault weapons than we did for normal small handguns and other things like that. So another statistic is the Department of Homeland Security's National Threat Assessment Center. 76% of school shootings are committed with guns taken from home. So 76 of unintentional shootings of children were committed with these unsecured home guns from home, sometimes stored in nightstands, under the bed, or other sleeping areas. So as you can tell, safely securing guns at home is vital to prevent these tragedies. So for each gun back that wanted to keep some of their guns, we did give them a gun lock. And there were quite a number that accepted them. And so not only did we dispose of weapons, but those that were not surrendered or credited or collected by us and kept by the participant are now safer because they'll be locked with a gun lock. So that's very important that we focus not only on collecting the guns, but on gun safety. So it wouldn't have been possible without the partnership of our local police departments. We wanted their participation because that spread the word, and they're all very anxious to get the weapons off the street. I had a chance to speak informally with a number of them, and the number of guns I run into is increased tenfold over the last years. They deal with them now almost every day. One officer said when he started 15 years ago, maybe twice a month they might run into a guns incident. Now it's every day. It's so prevalent. So what we're looking at is another gun buyback and trying to make it even bigger and more expansive, with all of Orange County participating. So this last time, Supervisor Sarmiento joined in, and that was terrific. See if we can't get all 5 supervisors and to do an even larger gun buyback program. After all, it takes only one bullet to take a life, and saving even one life by reducing the number of unwanted guns in the community, you can call that a victory. That's not enough. This question becomes, how can we continue to prevent gun violence? First, we must acknowledge that gun violence is a multifaceted issue. Not just a public safety issue, it's a social, education, and a health, especially mental health issue. Given this, prevention must be multifaceted and involve many sectors such as law enforcement, healthcare, mental health, education. Media is very important to get the word out, and even businesses. So, for instance, community partners can create more engaging ways to promote gun safety and raise awareness among owners of potential accidents that can happen. Engaging all sectors in the dialogue is vital, as each contributes unique insights and resources to both the complexities of the issue and pathways toward resolution and success. By integrating efforts across different sectors, law enforcement, public health, education, and community organizations, we can create a comprehensive strategy to address gun violence from multiple angles. As we move forward, it's imperative that we collectively explore innovative strategies and adopt cross-sectional approaches to tackle the multifaceted issue of gun violence. Recently, my office had a call with the Washington, D.C. Federal Office of Gun Violence, and they have a special office dealing with gun buybacks that they've started up. And we were talking about storage of weapons, where we can do that and how it can happen. So if you have a weapon, you don't need to leave it at home. You can safely store it somewhere else. So that's a discussion that is ongoing. Let us challenge ourselves, though, to think creatively, considering unconventional solutions and leverage the expertise and diverse stakeholders from all of the sectors. Each of us has a vital role to play in this endeavor, whether it's advocating for policy changes, supporting community-based initiatives, or contributing resources to innovative programs. Together, we can lead the charge in developing groundbreaking initiatives like gun storage that will mitigate the impact of gun violence in our communities. So thank all of you for attending. And I believe my wife, Paulette, is now one of your panelists. It's been my pleasure to address you this morning.
Thank you so much, Supervisor Chafee. We really appreciate your comments and your proactive action taken in conjunction with your peers to address this very serious issue in our community. And so again, thank you for being the first to actually be engaged in this effort. And in addition to the buyback events, and in addition to your recommendation and suggestion that it really does take a village, right? It does take multiple community stakeholders to get this done and addressed. What other maybe formal committees or formal decisions to allocate resources specifically for our communities, especially underserved areas that I believe are prevalent, right, with these type of situations and issues? What more concrete strategies or fixes or other recommendations do you or the Board of Supervisors have made or are thinking about making to address this issue?
Well, that's an ongoing discussion, and I think part of the issue is the federal, the state, county, and even cities need to join together. It's not very well coordinated, and we're always facing a voice that doesn't want to do this, like the NRA. And so it's important that we have a better collaborative effort. One of the issues, as always, with me has always been, we pass all these gun control laws, only to have the courts throw them out. So this taking guns off the street is one example of helping alleviate the problem. If you can't legislate these issues, well, let's see if we can't limit what it does. There's also the gun safety aspect. One of the things I'm thinking of trying to add to our next gun buyback is a safety component where we can have some separate gun safety issues for people that have guns and need to be trained. There's also issues with laws that require, and it's good laws, that require mental health examination before you buy a gun. One of the problems with that is you might be mentally healthy when you buy it, but unless there's a further follow-up, that mental health can change. And so the laws don't seem to require a second review, like every 5 years or something. I think that might be important because of the prevalence of drugs and other things in our community. Your mental health can be changed, and maybe you shouldn't have a weapon if that's the case. So I don't think there's any particular funding that is combined. I think from the county, we're going to continue to do what we can with the gun buyback and promote safety at the same time if we can.
Thank you, Supervisor Chafee. I think all of those issues are very, very critical. I think we as a country, we as a county, and specifically the areas affected, have had those conversations in the past and questioned why we can't do more of what you just recommended and stated. Is there an ongoing committee that, today you are joined by a cohort of community stakeholders that obviously are interested in this issue. Is there a committee, an upcoming event that we may be able to join or encourage folks to join so we can continue to help you? Because I think that it takes all of us to be able to get to our goals that we are supporting. And so we'd love to be able to do that. Is there a venue that we could join you in this?
Not that I am aware of. I think that's something we might look toward creating, so we have a more collaborative effort. The federal side can be helpful with some of their ideas. For example, we're looking at where can we create storage spaces. For example, if we could, the gun sellers are already in a secured location to secure the weapons that they are selling. Why can't we add some storage facilities there, for example? That was a discussion we were having just about 2 weeks ago. But there's no committee I'm aware of, and this would be something we could create and have a broader collaborative effort.
Great, thank you. I am looking to see if there is anything, any questions in the chat. I do see one. I see a question in the chat that says, is there anything that can be done on an advocacy level to help with this issue? And what can be done locally to support this effort? Promotoras would love to support. I think that was probably in line with the questions that I was asking of you, Supervisor Chafee, in terms of how can we join this effort. So we will definitely keep in touch with your office to make sure that we share any information around how we can, again, collectively get together and join this effort so that we can move the agenda, move the needle on this a little bit more now that we have engaged leaderships. Thank you so much for what you do for our county. Thank you for the leadership that you provide. And again, being bold and have the courage to address an issue that we know is not as popular, particularly in counties like ours. Are there any other live questions? I don't see any other. Thank you so much, Supervisor Chafee.
May I make one more remark?
Absolutely.
Comments. I think we need to establish something at the county level, perhaps a commission on gun safety that could review these things. And education is important, and just awareness of it. So I've been blessed to have a great staff that has helped create various commissions. Most recently, we created a commission on the status of women and girls. And before that, we created the Office of Immigration and Refugee Affairs. So we know how to create these things. It takes a positive vote from the board to do that. But I think that's something I'm going to have my staff do, is look into creating a county commission on gun safety.
We would definitely welcome that. Definitely look forward to joining and being part of that, as well as I'm sure many of those folks on the call today. Thank you so much.
Oh, my pleasure. Thank you.
Thank you. Okay, as Vice Chairman Chafee ends his portion of our welcoming remarks, I again want to extend our sincere gratitude and thanks to him and his office for opening up our Coffee Connections event today. I'd also like to take a moment to thank the offices of Congressman Mike Levin, Senators Josh Newman and Catherine Blakespear, and Assembly Members Sharon Quirk Silva and Lori Davis for joining this important conversation as well. Next, we're excited to hear from our keynote speaker, Dr. Maricen Ramirez, Professor of Environmental and Occupational Health and Associate Dean for Diversity, Equity, and Inclusion at the University of California, Irvine. Dr. Ramirez has been doing research in the area of injury and violence prevention, and we're excited to have her join us today and help us create shared language and understanding around firearm violence and injury. Dr. Ramirez, thank you for joining us today. The floor is yours.
Thank you so much, Isabella. I am going to share my screen and see. Right. Can everyone see that? My PowerPoint?
Yes.
Okay, let's put that on. Show start. Okay, excellent. Well, good morning, everyone. Just want to thank you for your time and your commitment to this area of work, gun violence prevention. I also want to thank our Supervisor Chafee for just the wonderful words that he has shared. I think you are truly a public health champion. And you practically have covered all the topics of my talk this morning. So thank you for sharing. Thank you for your commitment and really engaging in really public health intervention and action to prevent gun violence. So today I am going to discuss really some of the burning questions around gun violence as a public health issue. It certainly is a topic that we know has troubled our country for decades. And as a researcher, a public health professional, I'm an epidemiologist. We've actually struggled to find the funding at the national level to conduct this research. Things have changed, and we are delighted that finally the growing number of research studies that exist are really contributing to the prevention of gun violence. But we have more to do, much, much more work to do. So question number one, is firearm violence a public health problem? I think today we've got folks here on this call that hopefully affirm a positive yes to this answer, and to not think about this as just a criminal justice problem. And I think Supervisor Chafee really alluded to this, is that, clearly over the years, we have seen a tragic number of deaths happening in this country. In 2016, there were 251,000 deaths worldwide from firearm violence. And sadly, we must share that the United States, our country, has among the highest rates of firearm deaths. And so you could see here on the right, this slide, you could see the US really leading the way compared to other high-income countries with rates of firearm deaths over 10 per 100,000 compared to our counterparts, other high-income countries. We also look in America, looking at 6 countries, about 14% of deaths in the Americas are attributed or happening in the United States. Our supervisor also indicated the numbers and the growing numbers of firearm deaths. And we can see this trend over time. We're now in an age where over 26,000 suicides occur from firearms, over 21,000 murders involving firearms. And this, to me, as a person that studies childhood injury, is most troubling. In 2020, firearms became the leading cause of death for children, ages 1 to 19. And you could see over time, these are the trends. Motor vehicle crash had been the leading cause of death for young people. But sadly, in 2020, these trends have changed, and now we are seeing firearm deaths really leading the way in this country. Now, looking at the state of California here, here on your left, here are the rates of firearm homicide for youth under age 25. And what we could see is that, yes, we've seen a decreasing trend over time. We have a state we have been doing better, and we're now in a situation where our rates of firearm violence are lower than the rest of the country. So yes, that's good news. However, let's just look at then these numbers. While our rates are relatively low compared to the country, when we look over a 5-year period of time, looking at fatal and non-fatal gunshot injuries in our state by intent, these are our numbers. Our gunshot wounds by assault that we see in hospital and emergency departments, over 25,000. Over 9,000 deaths We look at self-harm, suicidal behavior, and suicide itself. Over 9,500 completed suicides, over 800 hospitalizations and emergency department visits. There's also these unintentional, what we call unintentional firearm accidental or quote accidental firearm related deaths, really high in number, over 20,000 that occur in that are seen in hospitals and emergency departments, over 200 deaths. And then there are legal firearm related deaths, which are police involved, for example. And these are the numbers of gunshot wounds seen in hospital EDs and also deaths. And then we do have quite a number of undetermined where we don't know specifically the intent of these firearm related deaths. So suffice to say, bottom line is, while our rates are lower than the rest of the country, the numbers are still extremely, extremely troubling and really, really amount to a public health problem. Here's some more data. On the left, we're looking at data in the state of California, looking at the number of domestic violence calls that involved firearms and threats. Again, this very troubling trend. What's happened after 2019 is this increase in the number of firearm-related domestic violence calls, number of hate crimes involving firearms per year. Tragically, these trends increasing. And it's not so much so different from the nation, what's happening across the country. Over 10,000 hate crimes are involve a firearm. Those domestic violence events, over 600 women are shot to death by an intimate partner. The presence of a gun in a domestic violence situation increases the risk of homicide over 5 times, and over 4.5 million women are threatened by a gun involving an intimate partner. So I'm hoping that, at least the epidemiologic trends have indicated to you why this is clearly a public health issue, not just something that we leave to law enforcement. And law enforcement is definitely part of the solution when we think about a public health approach to prevention. But we need to think about this proactively from a public health standpoint in terms of prevention. We don't want to wait until things escalate. We want to think about prevention, early intervention. So let's talk a little bit more about these trends and disparities and who are some of the populations, the communities at highest risk for firearm violence. And what's interesting to note, and this is some work that was conducted by Garen Wintemute out of the Firearm Violence Center up at UC Davis, he looked at national death rates from firearm homicide and suicide among males in 2015. And what you can see here, and we know this probably most frequently, most acutely, the high risk that our Black and Brown community or Black and Brown young men, the high rates of firearm homicide that they experience. And I would say what we probably pay less attention to is who's at risk for firearm suicide. And when we look at those trends, interestingly, we see white males over time, and particularly at the oldest age of this continuum, have the highest rates of firearm suicide. I do note, and we know that these are trends that have been reported in research, is that Black and Brown communities, especially in Black community, we are also seeing higher rates, increasingly higher rates of firearm suicide. So bottom line here is the disparities that exist. We know that there are groups with high rates of homicide, firearm homicide, Black young, and Hispanic young men. When we look at firearm suicide, we see that the highest rates are among older white men. So what are the impacts? Let's think about how individuals, families, and communities are impacted. We know that being injured, being shot, about 4% of Americans, about 10 million in our country have experienced this. About a fourth, 25% of Americans in the country have been threatened with a gun. And I'd really like you all to think about adverse child experiences. Firearm violence is a type of adversity. Being in communities that are impacted by firearm violence, seeing violence that occurs, firearm violence that occurs in their neighborhood, even on the media. This impacts child development, their physical as well as psychosocial health. And what's very interesting, Pew Research reports that over 57% of children fear school shootings. They fear that they'll be shot at school, and we see higher percentages among our children of color. About 63% of parents share the same fear. They're afraid that their child could be shot at school. So these are the kinds of things that are certainly impacting our communities throughout the world. Let's think about what are the economic impacts. At a national level, there have been studies that report that firearm violence costs over $229 billion each year, representing about 1.4% of the GDP. We also know that violent crime affects housing values across all neighborhoods, and that gun violence is associated with declines in economic activity. Now, looking at the state of California, also some research has conducted some economic studies indicating that the annual cost of gun violence is about $18 billion, and that every 3 hours, over 3,000 Californians die of gun violence. The impacts on employees are significant, in which we see there's lost income, so lost productivity, as well as losing jobs from disability and physical and mental health or illness. The costs are astronomical, over $5 billion in our state, direct cost of $39 million to our employers. So now thinking, another burning question that certainly has come up is whether or not mental health causes gun violence. And certainly, I really want us to think about what does that mean. When we do these studies in public health and conduct this research, I really always want you all to keep in mind that it is a complex puzzle of risk factors. And in fact, we in research has shown, and this is one thing that we want to be careful of criminalizing our people who have mental health illnesses and being cautious of that. And in fact, the research has shown that less than 5% of gun deaths are actually committed by people with mental illnesses, that the gun crimes are lower among those with mental health illnesses. We know that you're more likely to be shot by somebody that you know rather than a violent psychopath. Bottom line is the risk factors are numerous. It includes mental illness, but also includes child abuse, binge drinking, drugs. And in fact, many of these factors, drugs and prior violence, are much more predictive of future violence than mental health itself. So not to, again, reduce the importance of looking at mental health, but that, it's a complex web. And if we were going to focus our efforts on prevention, looking at history of violence, history of prior violence in particular, that being among the strongest risk factors for future violence, and including firearm violence. Okay. Another question, public health question that comes up, a burning question, is what about gun ownership? And what does that mean for prevention and cause of injury and death? So often we hear this question whether or not gun ownership actually increases our safety, because it allows our citizens to protect themselves. And we respect that part of our Constitution is the amendment and being the right to bear arms. Interestingly, with research that's been conducted, most Americans agree that gun ownership would increase the safety, and that many reasons, about almost 2/3 of the reason for ownership, include protection. And this has led to a really important question about exposure. How many adults are living in homes in a gun owning household? About 4 in 10 adults indicate that is the case. So but we've got a lot of exposure to firearms in our country, and mostly for the reason of protection. There are some data that indicate that in states that have higher rates of gun ownership, you could see this on the left. So the darker the purple scheme here, the higher the percentage of ownership. And if we look at this, this is an kind of a interesting like picture that shows it a broad ecologic relationship, but those same states also have the highest rates of firearm mortality. The darker the color, the higher the firearm death rate. So you could see here in the mountain states, you could see some of these same states that are darker blue in color are also darker purple. What does the science say? Additional studies. So it's interesting. There is sort of this contrasting viewpoint that we hear, and you may hear that guns don't kill people, but people kill people. This concept of what they call weapon substitution. Wolfgang conducted some studies in the 1950s and basically indicated that, you know, if we remove firearms from people's possession, that they would find other means to kill with the intent to kill. A counter argument that has been discussed is that guns don't kill people, but they make it really easy. When the task is simpler, it is going to be accomplished more often. And this is where we have seen a lot more research support this concept that having firearms, access to firearms increases violence, it increases the lethality. So you're more likely to see homicides, suicides, and unintentional firearm in deaths. Owners are 4 times likely to be shot than non-owners of firearms. And the use of firearms in self-defense is not very common. So at least this is what is really showing up in this research, rather than this concept that, you know, people will be able to find other weapons to successfully kill others. I do also want to keep in mind some of these questions that come up about gun possession and what's happening and why youth say they possess gun. Who are the youth? So I found this study to be extremely, extremely interesting, where youth who had owned or carried a gun that were in the courts in New York City were asked about their motivations. And so again, these were 300 youth that were carrying our own guns. They lived mostly in public health housing. They were asked, you know, why they possessed the guns and used guns. And it was out of this interesting generalized fear of being victimized or a specific fear of retaliation. Again, this concept of history of violent victimization really influenced their decision to carry a firearm. And many really actually lived in this fear of the state, particularly law enforcement. And I quote here, they held a widespread belief that they could be victimized anytime, and guns served to protect them from real or perceived threats from other gun carriers. So I bring up this research because it really helps us understand how we engage in prevention, especially among youth of color, who are our highest risk population for firearm homicide. So what is the public health to prevention? And I think I have a few more minutes to sort of quickly go through this. And, you know, our counselor really did mention this concept of being multifaceted. You know, we can think about policies that exist, and they are in existence, and there's research to show that some of these policies have been found to be effective. But it's more than just policies. We can't just have policies in the book. We need to think about, how do we educate our community about safe firearm safety? How do we create environments that reduce firearms? And I'll talk about that in a bit. And what kind of engineering designs maybe are being used, the locks that are used to keep firearms safe in storage. And really, at the end, what we want to think about is this multidisciplinary approach that's comprehensive. And I look to motor vehicle crashes where we've seen this success. It's really considered one of the most important public health successes in this country, where we've reduced motor vehicle crashes. And we look to that and say, what did we do right there? And can we think and conceptualize firearm safety the way that we've conceptualized motor vehicle safety? And that's what, I think the field is really thinking about and hoping for. What works? Again, in those buckets of, education, law enforcement, environment approaches, and really thinking community-based, these are just the types of interventions that are increasingly being utilized out there to address firearm violence, and not just, the event itself, but also the psychological events or impacts of violence and firearm violence. So they range from things like threat assessment and mental health first aid to community-based programs like Cease Fire or Cure Violence, which involve basically community partners embedded in the community workers working and connecting with at-risk youth. There's a really interesting research that has been looked at in mostly in New York and in Philadelphia that has started to examine green spacing. And they found that places and communities that really created green spaces, they were actually found to have lower rates of violence than areas that weren't green spaced. So very interesting research there. And then again, as I've mentioned, there are some laws that exist that we found, that we've done some research on, that we've seen have been effective. I'm not going to go through all of them, but I will say that at the end of the day, there still isn't a lot of science. We're well behind the curve compared to other health issues in this country. And so there is more work that needs to be done. I do want to close with a couple of slides, if I may, and I'm looking to my colleagues here when I'm close to time, but I do want to close with a couple of things that I'm doing. And really, it's like these are the things that I'm passionate about, working with youth in the community. And over 20 years, I've really been thinking about and developing interventions that really break this cycle of trauma that increase the risk of violence, including firearm violence. And the work that I've been doing has been taking a trauma-informed care lens so that we can look at the traumatic roots of violence, that we don't wait until it escalates to violent behaviors, severe violent behaviors later, but that we look early and we look in the school setting to find out what we can do. And so I'll briefly say that, we know that traumas exist in our world, and there are so many traumas that are impacting our children, that impact them, that impact their ability to learn, that impact their behaviors. And they're really part of this concept of adverse child experiences. And I mentioned that earlier, that firearms and exposure to, hearing shots in the neighborhood, witnessing that type of violence in the neighborhood, as well as being in homes where there are violent traumatic events, that altogether, this really leads to this condition where young people, they have increased stress. This impacts their development. And longer term, we have studies that have shown it is associated with future violence, as well as substance abuse, as well as chronic health conditions. And it really is about this concept that if a child is constantly being bombarded by trauma after trauma, that it impacts their thinking, their cognitive thinking, their prefrontal cortex, because their limbic system, that fight or flight response, is ongoing, is hyperactive. And so we need to think about really early on, how do we prevent firearm violence? By looking early, by thinking about and focusing on young kids. So this is a program that I've been, again, over 20 years has been in development, and we've been testing and delivering this to schools and to staff to really think about, can we address those traumas? Can we use a culturally responsive approach? And we equip our staff with these skills in psychological first aid, motivational interviewing. And what we want to do is really support youth as they're developing over their trajectory, really focused on those youth of color who have those traumas, who are at risk of firearm violence, particularly when they get to be, anywhere from 15, 16, 17, 18 up to 24. What can we do to support them? I believe it starts in schools. So we did this work. We've got, and just this is an example of what we did. These are schools that we worked in the state of Minnesota. We implemented training to over 1,000 school staff in our intervention. And I want to share with you, these are the kiddos that our staff worked with, that we trained them to work with kids who had the ACEs, who had histories of harassment, who have seen stabbings, shootings, and beatings in their community, who feel unsafe in their neighborhood. These are the Black, the brown children, the indigenous children that we worked with, and who had stress. They were 45 to 50% of these kids had stress indicators, and we train staff to support them one-on-one. We also trained our staff to be thinking about what is bias. And if we're helping our kids of color, how can we help them? Rather than criminalize them, put them in a system, we want to break that school to prison pipeline. And what we're seeing is that teachers are showing, or at least they're reporting, less racial bias. We are also seeing reductions in bullying behaviors, especially in our children of color, because of this intervention. And our hope is that we continue this work and working really diligently to bring this LINK program to Orange County, because I just started my position here at UCI. So we hope that we continue it. So in closing, I know I covered a ton of material, but there are some key points. Number one, firearm violence is a public health issue with significant impacts on our society. Okay, we know that, we see that in just the numbers of people who are hurt, the number of communities that are impacted, the economic cost, the psychosocial costs. They are great. There are disparities that exist and continue to persist. So we need to think about, how do we help and support those who are most at risk? That's what we need to do as public health professionals. More science is needed. But our approaches must be multidisciplinary. We can't be in our silos. We need to work with you all as community partners. And then I closed with this program that I'm trying to do, that we're testing and addressing really the traumatic roots of firearm violence. In fact, right now I'm working on a proposal in which we're going to integrate a threat assessment module and use this sort of link-based community or culturally responsive approach to how do we support our kids who are at highest risk. So I really want to thank you for your time. And if you have any questions, really feel free to contact me. I would love, love, love to work with you all as community partners so that we can really, really do something to address this important public health issue. Thank you so much.
Thank you, Dr. Ramirez. That was amazing. It was such a great educational presentation. I think you answered a lot of the questions with data that a lot of us have on our minds on a day-to-day basis when thinking about this issue. We definitely look forward to our continued partnership with you, and so glad you're here in Orange County. I do see a couple of questions, maybe comments in the chat, but I'm going to move us along and we'll come back to that towards the end of our session, because I think some of the comments were definitely addressed and readdressed, with your very thorough presentation. So again, thank you so much for your inspirational, definitely backed up with a lot of data. I took a lot of notes in terms of some of the aha moments that I had when listening to your comments. So we will definitely keep in touch and circle back with you. Thank you so much. So now, as we move forward with our event, we have an exciting lineup for our coffee chat segment. So without further ado, let's begin our moderated discussion. And now, I'm sure that our speakers are turning their cameras on as I speak, but before we start that discussion, I'd like to give all of our panelists a few minutes to introduce themselves. And so we will start with Dr. Kate Williamson first, then Stephen Kim, followed by Maria Dorado. Dr. Williamson?
Thank you so much, Isabel. Hello, everyone. My name is Kate Williamson. I'm a pediatrician, and I wear a few different hats, and wearing a couple of them for this event here. I'm a pediatrician with CHOC. I also work in a private practice in South Orange County, so that's my day job. And then I have done a lot of advocacy work through the American Academy of Pediatrics Orange County chapter. And one thing that I think that I'll talk about here is I was president of our chapter during the pandemic, and so really had an opportunity to partner with so many different community organizations, Orange County Healthcare Association, Orange County Department of Education. So being part of a multidisciplinary team from an advocacy perspective is really, really key. So thank you for having me.
Thank you. Stephen?
All right, thank you as well. I feel very honored to be with such greats, and so appreciate making the lineup here. Um, Local kid, Orange County, got into a lot of trouble as a kid, and experienced a lot of trauma, which I didn't understand was trauma growing up. But now, after living life that I lived, going through get my bachelor's at UCI and get my master's degree at USC, learned about trauma and had the privilege of working through the Orange County Department of Ed back in the day on working with incarcerated youth, and then moved on to a career of working on high-profile death penalty cases, figuring out the symptoms and causes of why people engage in violence. And so after that, had the great privilege in 2014 to work with many great people to create something called Project Kinship, which is a reentry organization in Orange County. And thank you for many of you on this call who've supported our partners. It's because of your collective efforts that we exist and are able to serve thousands of youth and adults in the county. And so today, I push a lot of paper and I get to do things like this. And so I'm privileged and honored to be here. Thank you.
Thank you, Steve. Maria?
Good morning, everyone. My name is Maria Dorado. I'm a public health nurse, and I serve as the Safety and Security Director for Altamed. We have federally qualified health centers throughout Orange County and the Los Angeles area. I'm very passionate about this topic because it's something that we do encounter frequently throughout the communities that we serve, and I'm very honored to be here with everybody.
Thank you, Maria, and thank you everyone for introducing yourselves. Let's dive into our conversation. Let's see, the first question that I have for all of the panelists are, first, what are some of the key misconceptions about gun violence, firearm violence, and injury? And how can creating a common language help in effectively combating these misconceptions? And we can go back and start with in the same order you introduced yourself. So Dr. Williamson.
Yes, first of all, it's a great question, and I think it's really we'll kind of feed back into some of the things that we say here in answer to this. So there's a lot of key misconceptions. I think first and foremost, I have found through my work in talking about gun violence and gun safety that a lot of people don't know, and in my world, parents don't know that gun violence and gun injury and death is the #1 cause of death in adolescence. And so that is a really, really important key thing. I think you really just having that basic, simple, and startling information out there for everybody to talk about and rally around is one of the biggest things. I think the other one in my mind is that this really at least should not be and is not a political issue. This is a safety issue. And I feel like it's very easy to find people who are alienated from even having this discussion. And so starting with, conversations like this is how we can move past that. And I think, thirdly, kind of feeding into that, making sure that we align, whether it is from the healthcare organizations, Orange County, Department of Public Health, schools, police forces, all of us are aligned in our messaging and making that as simple as possible so that everyone is hearing the same thing from everywhere and we can start moving forward with affecting change.
Thank you, Dr. Williamson. Steve?
I think for me, two quick things that come to mind is, a lot of our work, I'm sure many of you heard the question, what's wrong with you? And instead of asking what happened to you. And so in this situation, kind of the same thought comes to mind is we know what's wrong with gun violence, but it's really taking it back to what causes and what happened. And so I appreciate the doctor sharing her research. And I think it's really continuing to take that approach and those efforts because the outcomes are so significant and has deep impacts. But I think in addition to that, continuing to force ourselves to the what happened and the why. And in death penalty work, it was a big lesson that I've had to learn on, it's a very sensitive issue, especially with victims and folks who cause the harm. And so a lot of the thoughts that came to our work was, we don't want to make excuses, but we want to find the explanation. So similar to kind of the last question is, I think when we focus our efforts there, there's a lot of work to do. It's multi-pronged, but I feel like in these conversations, in these situations, the violence is so vivid and so visible, but making efforts to start our work beforehand on finding out the explanation so that we could figure out the how and the who on how to address these issues. So those are some thoughts.
Thank you, Maria.
And from the perspective that, I see it from the public health arena. It is a public health epidemic that we need to address. It impacts our communities at a larger scale. In addition to that, one of the things that I think is a common misconception is that, why should we involve the public healthcare system? The reason why we want to do that is because we want to make sure that, with this multifaceted approach that we need to combat this issue, it's going to require the entire community, the entire state to come together to provide resources and to leverage any individual that is in a decision-making capacity to be able to support and provide those resources at the real-time effort of, when the incidents occur, but also on a preventative level as well. So it will require prevention, but it also require interventions as well. In addition to that, it will require us to mitigate risk, and it will require us to have a multifaceted approach to having a community-wide education strategy in order to be able to increase awareness. Not increasing the awareness, it basically doesn't bring any light to the issues that we're seeing. And it's because it's multifaceted, it's not an easy solution, and it's not going to be a quick fix. It's going to require multiple resources from multiple agencies to be able to address. But having the healthcare system involved definitely provides a solid foundation because we already have established relationships with our patients.
Thank you, Maria. And all of the panelists for your answers to this question. I think the follow-up questions are going to go deeper into the details of some of your responses. So for Dr. Williamson, how do you think that firearm violence and injury impact the health, including the mental health of individuals and communities? And what role does the delivery system, the health, the academic, community-based, et cetera, play in addressing this issue?
Thank you for that question. For the first part, kind of how extensive and how deep is the impact of gun or firearm violence and safety? It's huge. It really impacts Every facet of someone's mental and potentially physical well-being, right? So if we think about gun violence and the way that somebody can be harmed by guns, we have mass shootings, we have accidental injury, and we have suicide. And so you take any population, whether it's adolescents who are struggling with mental health issues, you take toddlers who that family may not have a gun in their home, but that toddler goes on a play date in a household where they do have a gun and that child is at risk. And then in terms of mass shootings, we're all at risk. And so it really has an impact, or at least a potential impact on everyone. Specifically also something I've seen a lot in my clinical practice, and this affects younger kids as well as adolescents, is just the fear and awareness that their school could be a place of mass shooting literally at any time. I know, I've had conversations and we've talked about how now schools are doing firearm drills, just like they do earthquake drills, right? And that in and of itself could be a traumatic event. And we're seeing mental health on the rise for a number of, or mental health issues on the rise for a number of different reasons. And this is one of them. So I think in summary, we don't know the extent to which this is affecting our, everybody's health, but it's big. So what do we do about this, right? Like, how do we even start etching away at this conversation, start affecting change, particularly with a conversation that is not easy to have within Orange County and in California and in the rest of the country. So this is something I've thought a lot about and really tried to address with the American Academy of Pediatrics. And I think Number one is just start the conversation. Just start using the terms gun safety, gun violence, where there are departments that they can't even use the terms gun violence because it is so, politicized. And I think from a public health perspective, public health, we need to take ownership of this conversation because we need to frame this in the way that it actually is. This is a public safety issue. That's it, simple and true, and it is huge. And so it is on us who are in the public health sectors to make sure that we are leading this, because we are known to be the ones who are fighting for the health of our patients and those in the community. And we need to partner with everyone in the community. So another key part of this, so one is public health, two is awareness, and then three is really having common language. So something that we've done at the American Academy of Pediatrics of Orange County is there was a bill that was passed a little over a year ago, and starting the fall, going to the school year, education needed to be given to all parents about guns. And so we partnered with our organization, of course, Orange County Medical Associations, Chalk Hospital, UCI, Orange County Healthcare Agency, OCDE, all together, and put together essentially a handout that talks about 1 in 3 households have US firearms. It talks about gun-related injuries are the top cause of death for our kids and teens, all in one simple language. And that went through so many different revisions over many months, but we were able at the end of the day to say, this is simple language, this is what we are stating, this is fact, and this is put out by all these respected organizations. It's a small piece, but it's a start. And I think the more that we can unify on simple common language from multiple areas that are respected, people will start to hear that, I hope.
Thank you, Dr. Wilson. That's great. Great feedback on that. I just absolutely love that. So for Maria, could you share some effective strategies or initiatives from your organization that you've implemented for firearm violence and injury prevention, especially within the vulnerable populations that we're talking about?
Absolutely. Within our health center, we already provide initial and annual screenings to determine if there is a firearm in the home. So that sets the platform for the neutral conversation that allows our providers and our healthcare practitioners to be able to provide some anticipatory guidance, be able to increase awareness about gun safety and injury prevention. It talks about, they are able to provide, what are some of the storage components that, you should put into place when you own a firearm. Sometimes, even though they may be provided when they bought the firearm, but things change over time. And when things change over time, relationships change over time. So it may have been that, when the patient came in initially, as a newborn, there weren't any risk factors present. They were doing everything, by the letter of the law. And then all of a sudden we start getting comfortable, things start changing, and now there are some risk factors involved. So having those annual surveys being done can be very helpful to provide that level of conversation. It provides check-ins during the future visits, but it also allows a provider to identify risk factors and then be able to provide resources to mitigate some of those risks. And then you're leveraging also a lot of your community partnerships with local law enforcement can make a huge difference. Sometimes it can be difficult conversations to have, but ultimately you want to provide them with the actual resources that are going to provide them the solution that they need, so that they, or at least so they can make an informed decision. If you provide them various multiple interventions that they can do, and it's going to have to be customized to what the patient needs at the time. So those things are very, very important. It's not a one size fits all. And that's why those risk assessments are very, very crucial in order for us to be able to mitigate the risk. And then what resources do we need to then be able to provide the patient with the appropriate interventions.
Thank you so much, Maria. That's great feedback from the ground, if you will. Stephen, what are,
Hi.
let's see, I'm sorry. Yeah, from your experience working directly with communities impacted by firearm violence and injury and/or incarceration, what are some of the unique challenges and opportunities in addressing firearm violence and injury at the grassroots level?
Awesome. Thank you so much. We've learned over and over again that gun violence, especially in marginalized communities, as we mentioned before, always about the symptom. It's always a symptom of something deeper. We know that it's connected with childhood abuse, violence, family violence, and various types of trauma. In just the past 3 days, we've had 5 shootings in one of our cities where a 12-year-old was recently shot and a 19-year-old was shot. And I've had the privilege of sitting at the hospital that night when the 19-year-old was shot with his family, with some of our team members. And unfortunately, we experienced a family hearing the news of their son and brother passing away. And you're reminded that there's nothing close to the cries of a mom and a sister and a family grieving a loved one. And you can't wrap your arms around such pain. And what it reminded me is everyone in the hallway that pain is carried together by community and it's infectious. It's not isolated. When parts of our community gets impacted by violence, we all get impacted in some way. And we carry the pain together in some way. But we also know with the right resources, care, and support that hope's possible. And we know that many times people just need someone who'll sit with them in the pain without words, without anything, just to sit with them. And then from there, we move on figuring out how do we support in other ways. It's funny because as I was sitting there trying to hold this pain, and many of us in this work carry vicarious trauma and secondary trauma, and we try to figure out how to stay in the long game for this. But we've also learned that healing comes in community. We had the privilege to watch 2 of our staff members graduate from Santa Ana College. If you haven't been to a Santa Ana College graduation, you need to go because after in the parking lot, it's a party. It's a celebration and party. And some of the beautiful things I've seen was fathers hugging their sons and daughters who've carried significant life challenges to graduate at that place, saying that life has thrown what it's thrown at me, but I've graduated. And the moments of proudness of watching family members hug, it was quite something special. And they also had a dance party in the parking lot, which I thought was cool. But in that place, there's 2 folks that we get to work with at Project Kinship who have over 30 years of incarceration, have overcome serious challenges, including gun violence, graduating. And I watched him hug his father, and both of them were in tears, and it was so beautiful. And when I think about community as we hold our pain together, we also celebrate and hold healing together. That as one part of our community heals, all of us heal. And that kinship happens so quickly that if you blink, you'll miss it. You want to create opportunities and spaces in all of our fields and all of our communities where this type of healing exists in community. At that same graduation, there's a 20-year-old kid who we worked with for years. And it's like the type of kid that you're like, are you going to get better? Are you going to be well? And we learn over and over again that you don't put the standard up and wait for people to get it to achieve. You sit with them and you walk with them until they achieve it. And it's on their time. Well, now at 20 years old, he's got a job, he's got a family, he's doing amazing. And as he was watching in the graduation, watching our other guys graduating, he quietly said, I'm next. And I looked at him, I said, what do you mean I'm next? He says, I'm going to graduate too. And he is going to enroll to start his work. But the reason why I share him is I was thinking about today and I asked him, hey, dude, how would you answer this question? He said, the neighborhood I grew up in, we just need more opportunities. In my neighborhood, all I knew was the gang and everything that was waiting for me once I stepped out of my house or my apartment was violence and gangs. That's all we know. And then he said, over the years, I've learned that there's other things out there. I love my neighborhood, but I've also learned that there's other opportunities out there. And for him, he took one where a hand grabbed him and took him to mentoring, took him to get his GED, his license, and now his place of employment. And now he'll be enrolling in school. But, I like stories. And so he also said, hey, he goes, I also remember going to Morton's for the first time. And I was like Morton, a friend, or Morton, the steakhouse? He goes, no, the steakhouse is where they have all those forks there. And as he talked about eating that steak for the first time, I assumed that the steak was the highlight of that trip. And I said, God, wasn't the steak amazing? What kind of steak did you get? He goes, I don't know what type of steak I got. He goes, a steak was nice, but what I remember is sitting at that table with my mom, my sister, my brother and girlfriend, and eating food together. He goes, it wasn't the steak. It was I got to go there for the first time with my family. And then he said, it cost me my damn 3 paychecks. He goes, but it was worth every penny. So the reason why I share that is we talk about violence and we talk about how do we address these things. People don't go out and engage in violence when they have safe spaces, when they have resources, support holistically well, when they have dignity, and when they're truly seen. I guarantee you that day after spending that time with his family, gun violence was the last thing on his mind. It was hope, it was inspiration, it was the pursuit of success that was on his mind. And so I'm really appreciative of this time to be here with you all because I know in this space, all of you here are also creating spaces where sometimes we hold pain together, but we're also creating opportunities for us to hold joy together. Thank you.
Well, thank you, Stephen. I think your comments remind me that collectively, right, including what Dr. Williamson is doing, what Maria is doing at Ultimate, and what you're doing at Project Kinship, really wraps the services around the individuals that we're trying to save, show a better life, give hope, and bring them out of the shadows, if you will, because I wholeheartedly agree that it takes all of us, right, to get that done. But I agree that we never know what individual is going to shed that light or give an individual hope or show them, what else is possible outside of their neighborhood. And thank you so much for what you do and your stories. I can definitely relate to all of them. Lived it myself and really believe in the fact that we need to make sure that we create the spaces and opportunities for these young individuals so that they're not stuck in this vicious cycle of fighting for a neighborhood that's definitely, it's not theirs, to the same extent as they think it is, but that there are definitely opportunities out there for them to succeed. Now, I know that we're very short on time. I have additional questions. And so I'm looking to my colleagues to make sure that we actually do have the time to do that. But I will move on to the actionable takeaways for all. And in here, you can address any other areas that you wanted to address, but I didn't get to ask you. But from your perspective, back to Dr. Williamson, if an organization, I'm going to ask all of you the same thing, right? So from your perspective, if an organization wants to begin incorporating a comprehensive or preliminary approach to addressing the issue of firearm violence and injury, and building support and resilience for individual communities, where would you recommend they start?
It's a great question. And I feel like we will, a lot of the discussion here will be leading back to this group here, because I really think that this is where it starts. I think that finding a like organization to see if there is some kind of roadmap or pathway in terms of talking points would be really helpful. I'll say from the physician side of it, yes, we do have education. We've done some webinars. We partnered with National AAP, American Academy of Pediatrics. So there are resources everywhere. I think the hard part is finding them and knowing which one applies to you. So, Isabel, you can share with us here if we can be sort of a resource, like if there's ever from the healthcare side questions about how to start, they can reach out to me, right? We can get started and through the American Academy of Pediatrics. And I'm assuming, for Maria and for Steve, with your expertise, you'd be able to be resources as well.
Thank you so much. Maria?
Sorry about that. I was having some technical issues there. But yes, definitely starting sometimes can be the most difficult part. But I would say that leveraging the resources, as Dr. Williamson, provided herself as a resource, definitely I'm always available. I love answering questions and being able to collaborate. Having the evidence-based tools to provide the education is important. How do you establish community partnerships? Sometimes it's very easy, just as as easy as picking up the phone and calling the chief of police of your local police station. That in itself has a lot of leverage. They have an array of talent that is available to provide resources to the community, education, and they also do it in a culturally competent manner. So I always encourage, leveraging those partnerships because they have a wealth of information, a wealth of resources. In addition to that, your community partners, community coalitions also have a lot of resources available as well. So just as long as you want to start, just give us a call and we'll be more than happy to provide some guidance.
Thank you so much, Maria. Steve?
Yeah, I would say we always say connection and partnership is the curriculum. And so what we have found is, kinship, we are so grateful for, opportunities like this, but just real quickly, we've grown from 2 staff in 2014 to 135 today, which is a lot for us, and from that, the great thing is the partnership and the collaborations with, county agencies, school districts, nonprofits, faith-based agencies, and communities. And so just to give a snapshot of our experience, we're now in over 35 schools in 5 districts, in every unit at juvenile hall, 24/7 outside the county jail. Every person that gets out gets to see us in the community and all these things. But the reason why I share that is we're also busy doing our work and we're great at what we do. But I feel like even for ourselves, these intentional spaces just to connect and come together as a community, see each other's faces to learn, but also just sit together has been high value for myself. And so for me, it's finding organizations, spaces like this to connect, to learn more about each other, and to bolster and strengthen our partnerships to collectively address multiple issues such as gun violence.
Thank you so much, Steve. And again, being cognizant of our time, I want to just remind everyone, this is just the beginning, right, of this collaboration of this and this work that we want to proactively continue to do with and for the community. I know that there were a couple of questions in the chat, and I hope that those were answered throughout the discussion. If not, we'll definitely go back and create a Q&A and share with everyone who attended the conference today. And so as we close out this event, I really want to extend my heartfelt gratitude to each and every one of you for your active participation and thoughtful contributions throughout our discussions on community health and focus, the delivery system's approach to gun violence. We've had the privilege of hearing from some of our leading and passionate voices in Orange County, and their insights have been enlightening and inspiring. Thank you again to our speakers and our audience. And as you know, we've explored a very important but uncomfortable topic on community health and firearm violence and injury. It's a complex issue, but working together, as we've stated, on leveraging the expertise and resources, as limited or plentiful as they could be, I think we can definitely make a meaningful impact because we each represent a different aspect of life that our community is going to navigate through, whether it's the educational system, the community, the healthcare system, the neighborhood. We definitely, I think, are here to hold hands and make sure that nobody falls through the cracks as much as we can prevent it. So I'm going to share some takeaways that I got over our last 90 minutes together. Chairman Chafee shared that the biggest firearm violence was in Seal Beach, October of 2011. 29 individuals passed away. The OC coroner shared in 2023 that 161 people died due to gun violence. And again, I don't need to reemphasize that this definitely represents a story of loss and devastation. He was the first supervisor to start the gun buyback event in our county, with the second one following in May of this year. Between the two events, a total of 757 firearms, including 53 assault weapons, were collected. Again, collaboration and partnership is key to make sure that we continue these efforts. I think that an action that we should be looking forward to and demanding for our county is that we get all 5 supervisors together to host, and not just them, but every elected official within every city and neighborhood, and ask every assemblyman, elected official, senator and whatnot, congressmen and women, to really support this issue, because we really need all of them, to make sure that we effectively address this. because, you know, even if saving one life is what we do, it's well worth the effort. So we need to, we asked, what can we do? What can Chairman Chafee do more concretely? We want to have an established commission on gun safety at the county level. I thought I heard him say he would do it. I think we need to hold him accountable to that and continue to push forward on that area. Dr. Ramirez shared that firearm violence is a public health issue with significant impacts on society. We shouldn't think about this just as a criminal justice problem, but rather a public health crisis, and I wholeheartedly agree. Disparities do exist and are persistent, and more specifically, firearm violence is an adversity impacting childhood development, physical and psychosocial health. In 2020, firearms became the leading cause of death among children and adolescents. More science is needed, but approaches must be multidisciplinary. And the most powerful predictor of future violence is history of violent behavior more than any other factor. LINK is the program that she talked about, is a school-based program being tested to address traumatic roots of firearm violence. And I would love to see that implemented in every school, you know, within our county. I'll share just a tidbit. I was on the foundation. I was a board member on the California Wellness Foundation, and for 12 years. And as a board member, you are able to fund. You're given a fund to fund programs, you know, within your community. And when I should have, and my children were in elementary school, and when I should have been funding after-school programs and more community-based educational programs, I was funding the building of fences around my kids' schools and in schools that were in some of the hot spots, you know, that were being faced with more of this type of violence. And as I think back, you know, it's a sign of what we were living and what we continue to live. We shouldn't be focused on that, but we have to, because that is our reality. And so I think we need more education, we need more resources to make sure that that kind of violence, or that our children aren't growing up in that type of environment that then further exacerbates, you know, their need to continue that cycle. The panel shared that there's a continued need for a unified message across all sectors. So the same message is heard from everyone. The importance of starting the conversation using the words gun violence and gun safety. We need to make that a norm. Public health needs to take ownership of this conversation, as this is not a political issue, it's a public safety issue. We need to focus on the why. What is the reason for gun violence? Don't make excuses, but look for explanations. At a health center level, we can implement annual screenings to assess how many firearms are in the home. This allows health centers to assess how to help families and build relationships with different stakeholders like law enforcement. We really stress the need and support for safe spaces, and to really truly be seen. We need to have wraparound services around the individuals we want to bring hope for. And several of the actionable takeaways, we want to find a like organization with a roadmap and talking points. Physicians do have education and webinars, and partnering with the National American Academy of Pediatrics. You know, the hard part is finding resources, and which is the right type of funding for the work that we need to do. Starting can be the most difficult part, but we need to leverage resources, including our community, our panel members, our partners, you know, those that want to join us in this effort, and having and using evidence-based tools to build the relationships with local stakeholders. And connection and partnership is the curriculum. I love that. We need to live by that. And again, as we conclude, I hope each of you feels more informed and empowered to take action in your own spheres of influence. The knowledge shared today is just the beginning. It's up to all of us to continue the conversation, to build on these ideas, and to implement the strategies discussed. And with that said, the coalition will be hosting a few lunch and learns on firearm violence and injury following today's event. We will follow up with more information, resources from today's event, and a quick survey. Thank you so much again for your participation, your dedication, and your commitment to creating a better future. We look forward to seeing you at our next Coffee Connections event scheduled for Friday, September 13th. 2024. And of course, we hope to see you all at our 50th anniversary gala, which will be held on November 21st of this year in the city of Anaheim. And with that, I think we are done. Thank you, everyone. Have a great rest of your day.